Hi, and welcome back to Hey Doc, What's Up? We've been doing our series on estrogen dominance and what that means to specific female organs. In particular, we talked about ovarian cysts, recurrent ovarian cysts, uterine fibroids, endometriosis. Those are all pelvic organs. Well, another organ that is highly influenced by estrogen dominance is our breast. So our breasts are both estrogen and progesterone influenced, but in particular, very, very sensitive to what our estradiol levels are. It influences the size of a breast and it influences the development of a breast. So each breast has about 6 to 8 lobules, if you think about it as sectioning it off. And those lobules have a duct that comes up to the nipple and is a way for a breastfeeding mom to feed their baby. So those ducts, you would think, are then just a single road that delivers fluid, but realize that it is going to pull from all of the tissue around it. So that main freeway, that main road, has other side roads that come off of it and that feed that fluid that they're going to make to that main duct, which then will deliver it when it is asked to be delivered. So it's very important to understand that too much of a good thing may build too many roads. And if you have too many ducts, too many roads feeding into that duct, you may actually have tissue and ducts that will roll up on themselves or blow up to be bigger than they should be, and those can represent cysts, or what is called fibrocystic breast disease. So on a mammogram, what will happen with estrogen dominance is a breast will not only look more cystic, but it will look denser. So you are influencing both the support tissue as well as cystic tissue. That cystic tissue can hide what's going on behind it. So many times with mammograms, they're going to want to do a compression, or they're going to want to do a second alternate view so they get a look behind where some of this denser breast tissue is actually potentially hiding pathology. But know that fibrocystic breast disease, dense breasts, and cystic breasts can have estrogen as the cause, and estrogen dominance in particular is the cause. Caffeine can be a cause to stimulate cystic disease, and it can make cystic disease hurt more. But realize the main driver is an estradiol dominance, which is why for a lot of women, having their mammogram first at age 40 may be too late, and you may actually have to start it sooner, not only based on family history, but on estrogen dominance. For those women who don't know if they're estrogen dominant, then you really need to know, because it may impact your breast health. Realize that a lot of breast cancer can actually be stimulated by estrogen dominance, and it doesn't go from a negative mammogram one day to a breast cancer the next day. There are stages of abnormal that happen with atypia with hyperplasia, ductal atypia that has complexity to it, and the next step beyond that is actually breast cancer. Again, many breast cancers are hormone driven. Not all, however. There are other breast cancers that are not, but the majority of breast cancers that happen actually happen because of estrogen dominance. And if that's the case, you have some control over whether or not you're going to end up with that type of picture. So many menopausal women in particular, their breast cancer is not genetic. It is not BRCA driven. It is actually hormone imbalance driven. And so knowing what your hormone levels are is huge as far as not only your pelvic health, but the health of your breast. So check in with us next time at Hey Doc, What's Up?